What does the pink arrow point at? We see a crescent-shaped lucency along the outer aspect of a cavity with an inner mass in the left upper lung zone. This is the air crescent sign. An air crescent is a collection of air in a crescentic or sometimes circumferential shape that separates the wall of the cavity from an inner mass. It's often considered a sign of fungal colonization, particularly aspergillosis, of a pre-existing cavity. Pre-existing cavities include tuberculosis, sarcoidosis, bronchiectasis, or lung cancer. It may also be seen in retraction of infarcted lung in angioinvasive aspergillosis. As we see here on this axial CT, there is severe traction bronchiectasis and honeycombing in the upper lobes as a consequence of sarcoidosis. A mycetoma or fungal ball has formed within a cystic space in the left upper lobe. Here's another axial CT showing typical CT features of angioinvasive aspergillosis. Note the halo sign surrounding the lesion, as seen by the white arrow with the ground glass surrounding the lesion, and the air crescent sign shown by the black arrow. This is caused by tissue necrosis and retraction. Again, other causes for an air crescent include tuberculosis, granulomatosis with polyangiitis or Wegener's, intracavitary hemorrhage, lung cancer, particularly the cavitary necrotic type, and hydatid disease. For example, this axial CT in a patient with primary lung cancer shows a right upper lobe spiculated cavitary mass. There's tissue necrosis and retraction, producing an air crescent sign that mimics the imaging findings of angioinvasive fungal infection. Here's an example of hydatid disease. There's air between the pericyst and the endocyst with a contained cyst rupture in the left upper lobe. This was a young child with hydatid disease. Here is an X-ray of a patient with sarcoidosis showing a right upper lobe mycetoma that developed in a pre-existing cavity, exhibiting the air crescent sign. Here are supine and prone images showing a patient with a right lower lobe mycetoma secondary to non-tuberculous mycobacterial infection. Note the non-dependent air crescent sign and migration of the fungus ball to the dependent portion of the cavity. Here's another example of supine and prone images, this time of a patient with a left upper mycetoma within a pre-existing cavity from non-tuberculous mycobacterium. Note the air crescent configuration in the non-dependent aspect of the cavity and migration of the fungus ball to the dependent aspect of the cavity. In clinical practice, the air crescent sign is characteristically identified in patients with mycetoma. On the left, we have an X-ray, on the right, an axial CT. This is a patient with angioinvasive aspergillosis showing a left upper lobe cavity with internal heterogeneous soft tissue representing necrotic lung. Note the surrounding crescent of intracavitary air producing the air crescent sign. You now know a lot about the air crescent sign. Please subscribe for more awesome anatomy and radiology videos.